Good evening and welcome to Information Please, your Peoria Public Library on the air, and bring you information about your library and your community. And this evening my guest is Monica Hendrickson, who's an epidemiologist with the Peoria City-County Health Department, and we're going to talk about vaccinations. Hi Monica.
Hi, how are you?
I'm great. How are you?
Good.
Tell me what an epidemiologist is. It's a big word. Not a lot of people know.
No, they don't. An epidemiologist is an individual that looks at different risk factors and conditions and how they affect health, whether it is an infectious disease or virus, all the way to if you're a smoker or you don't exercise as much, as even down to your household income and how it really all plays into your health.
Oh, interesting. And so as part of that, of course, you would know about vaccinations and what goes on. But in really simple terms, can you tell me what a vaccination is? How does it work?
So the best way to understand a vaccine is it is a way of educating your body about a virus, getting it prepared and handling it in a way that is safe versus actually having the disease itself.
Okay.
So it's a way of your body adjusting, developing antibodies to fight off different viruses in a safe and controlled way versus actually
Getting really, really, really sick.
Exactly.
Okay. How long have vaccinations been around?
For a while.
Hundreds of years.
Hundreds of years. You know, at first in some communities it was the idea of understanding that someone developed, for example, cowpox, which was the dairy maids had cowpox and it didn't seem so bad. So and it looked like how their reaction was a way of them developing vaccine or immunization against smallpox eventually. So it's been around in some form or fashion for decades now.
Yeah, we don't hear about people in this country anyway getting smallpox, but it used to be a horrible, horrible thing. In fact, it was used for germ warfare early on in this country, with giving natives blankets from infected people to make sure they'd get sick. Horrible thing to think about, but right now, vaccinations are in the spotlight due to that recent outbreak of measles that began at Disneyland. So most people think that, you know, oh, measles are gone, like smallpox. Who do you know that ever had measles, except old people like me? And so how does an outbreak like that occur in this day and age?
Oddly, it happens because of a little bit of complacency. So first of all, no true disease or virus like that is completely eradicated, meaning eliminated. It is somewhere in the world population, and as a global dynamic, we're no longer just very much isolated pockets of people. It is the ability for us to come into contact with it is actually still there. The problem now is, though, like you mentioned, people don't know anyone directly that had measles or had polio even.
Right.
It's something that was from years ago. And so we're becoming complacent in the fact that we're not choosing to vaccinate. And by not choosing to vaccinate, all this really great public health effort and healthcare community effort in developing kind of this protective barrier around us is starting to chip away. And so people are getting exposed to it. And in the case with Disneyland, it was individuals that were not vaccinated.
Was it a visitor from another country that started it, or has anybody identified the famous patient zero?
No, they do understand, though, it was from the trend of how it spread, it was through people that were unvaccinated, though.
Okay, so people who didn't vaccinate, they go to Disneyland for vacation, they bring home measles.
And when we talk about, in the term of this discussion, vaccination, we're talking about people that have been fully vaccinated, meaning that they've gotten their full dosages or their full schedule of shots. Sometimes vaccines we have to take about 3. A great example is hepatitis B. You have to get 3 vaccines to be completely vaccinated against this.
Okay.
So even just one, which sometimes people say, well, I had my 1 shot and I still developed it. Well, did you fully complete the full vaccine schedule?
The whole thing.
Exactly.
Yeah. Or in the case of the flu vaccine, which I had the full-on, all 4 strains, and my husband and I both got the flu at the same time. I had felt bad and had sniffles for 2 days. He was in bed for 10 days.
Yeah.
So although I still got sick and I missed 2 days of work, I was not sick the way he was, where he was like delirious and, scary, scary sick.
Definitely.
So even though people say, well, I still got the flu, it's
very different.
Huge difference. Huge difference.
Exactly.
When you've had a vaccination and are protected and have it. Okay, well, I've heard this term herd immunity. What does that mean?
So herd immunity is how we describe the protective effects of a vaccine. So for example, it is the idea that as a population or a group of people, what we're doing is by vaccinating, we're protecting individuals that are unable to get vaccinated, whether it's for medical reasons or they're too young, from these diseases. So we're kind of creating a barrier for them.
Okay.
So that's the idea of herd immunity. Really, me vaccinating, yes, it does take care of me, but at the same time, it also protects you because I won't be able to transfer anything to you as well.
Right, to transfer. So that does really help. Tell me, why do people object to vaccines?
There's a lot of reasons out there. I think some of it has to do with the fact that what you mentioned earlier, we really don't see a lot of these diseases prevalent in our community. So if they're not there, that means why am I taking what they consider unnecessary medical risks for something they don't see? The other reason is some people cite a very controversial research paper that has been since very much discredited to the point of exactly about the linkage of certain vaccines to autism.
Right.
And so that type of fear that comes with it, and understanding or lack of understanding, is really provides it. And then I think lastly is kind of an understanding of what vaccines really do. And we live in a world where information is not only just computer, now it's on your phone, click away, and where people are getting their trusted information, and that's the thing which we really appreciate. What the library does is having that portal for information, because those are really trusted and reliable sources. Yeah,
we do have that, and I think the thing with vaccines and autism, people heard that and they've hung on to it because people want an answer for what causes autism. And it's like anything else. We want to know, we want to do something. And if it's an old wives' tale, though, then you've made the wrong choice. Yeah. Well, I've got some great information from the health department here too. This one is a graphic on what they do to develop a vaccine and make sure it's safe. And you're talking hundreds of thousands of people testing something, and so then you're going to find out what side effects are, what everything. Yes. So that's great information that you can get from the health department. And then you mentioned our portal. This is it. If you just go to the Peoria Public Library website and we have a tab on there that says research, and if you go under research, you'll find all sorts of, it's divided into things like students and genealogists and business, but you can always find everything if you go under all, and you'll find this health and wellness resource. And I actually just had my graphic designer do this screenshot of it. When you do a search, it'll pull up all sorts of resources. Great. And I actually pulled up an article on the anti-vaccine movement, and it's from Consumer Healthcare in Farmington Hills, Michigan, published in 2014, and it goes on and on, gives all the points, but it does it not in a heavy-handed way. It does it in a true journalistic way where it presents the facts and lets you make up your own mind, which is what the library is all about. Make up your own mind. But if you're going to make up your own mind, let's do it with valid information.
Definitely.
So clicking away on your phone on Google is not going to give you the same answer that looking up verified information at the library will. And one of the reasons we don't have so many books on healthcare anymore is because that information gets outdated so quickly. But when you have these electronic sources that you use with your library card and your PIN from anywhere, you can click away on your phone to the library as easily as you can to Google. These sources change. The minute something new is verified, it changes, and so you're always going to get the latest, and you're not going to get anything outdated there. So That's a
Definitely
great way to do it. Yeah, yeah. So let's talk a little bit about people think, oh, so what, my kid will get sick and I'll keep them away from everybody. But it has a huge impact on society too. And this little graphic can tell you that. What do you think vaccinating does for society?
I think the biggest thing it does is it creates a healthy population. It is, and you kind of have to look at this on a global sphere, how really lucky we are as a country and a community where we have access to a great healthcare system that has immunizations. It's not a burden that we think about. We don't think about the fact that there's a chance of our child developing measles or polio. And it's something that really allows us to have a healthy population that can really excel. Because really health is a universal need, and protecting it allows us to then explore different endeavors, such as, becoming a stronger economic country. All comes back to being strongly having good healthcare system.
Having good health. I think
exactly.
People don't translate something like measles down to the impact on their own life. But if you think about it, and I had all these, we were talking before the show, I'm old enough that I had all of these things. I didn't have polio, but I can remember being kept home because polio was out in the community in the summer, not being allowed to go swimming. I was pretty young, just starting school. But I can remember not being allowed to go to movies, not being allowed to go to the library because people in the community had polio. And my mother was terrified of it because she had seen the effects of many people, who died, people who crippled for life. So polio I never had. Everything else I had. And I was terribly ill. And if you think about you get measles, well, right away, there's 10 days. You're not going anywhere.
Definitely.
Well, obviously you need nursing care. Who's going to stay with you for 10 days? Does that mean mom and dad are both taking time off work? What if the other children in the house can get exposed before you even know the first one had measles? And if you have 3 kids, there's 30 days, boom, 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 of people being sick.
And it's not just even measles, even the flu shot's a great example.
Yep.
You mentioned that.
Yep.
A lot of people, like you said, say, oh, I had the flu when I got the flu shot. To really fully appreciate the flu, really, you're out for about 10 to 14 days, really
You
out.
are really sick.
And on the financial basis, getting a $15 or $20 flu shot versus missing 10 days of school, daycare, work, the cost benefit also comes in.
If you're lucky and you have sick time at work,
Exactly. Very lucky to have that.
if you're lucky and you have sick time at work, great. What if you don't have sick time? That's a huge financial hit on anybody. And to be listening to outdated information, really, you got to really think hard about what you're doing.
Yeah,
Really.
and I think it's also going back to that, it's a community response, that herd response aspect. We live in an area where nowadays where a lot of people relate to peanut allergies.
Yes.
I know my own child goes to a daycare where there's students there that have peanut allergies. So when I was younger, my mom or dad could make something at home and I could bring it in for birthdays. Now it has to be very much protective, sealed, all the ingredients. And we do that not because my own child has a peanut allergy, because there is somebody else's child that has that type of reaction. And so we're doing our best to protect that other child.
Right.
The same thing with vaccines. You don't know what your child's current disease status is, whether, you don't go daily to the doctor to say, oh, they don't have measles, they don't have pertussis, we drew their blood, we did the test, you don't do that daily.
No.
So the way we really correct for that is, as we vaccine, we're able to protect those other kids that don't have that opportunity to, and maybe it's age or medical reasons, to really get vaccinated.
There are some people who medically can't
Exactly.
get vaccines.
Yes.
I have a child growing up now, but has an allergy to eggs, breaks out in hives. And so that's always been a huge concern. She's taken the option as an adult, which I did with her as a child, was sign off and get it anyway, because having hives, and which she hasn't, but having hives is a lot lower risk than, and she's right there at the doctor's office where if she should have a really bad reaction, they can treat her, but so far so good. So, but that's people's choice when they have those allergies. But if you have those 1 or 2 people, we can protect all of them. You have people who are very frail, have all sorts of, things.
Autoimmune issues.
Yeah,
Exactly.
but there aren't that many of them, and the rest of us can help them out.
Exactly.
Yeah.
And the other thing to note about when we talk about vaccines too is that really you should be working with your pediatrician and really following the the American Academy's guidelines on this, because some parents don't vaccinate and others do delayed vaccinations. And even delayed vaccinations, there's no true benefit in delaying it.
No.
At all. The research actually is skewed the other way, where we have, like you saw the slide about all the types of phases that a vaccine goes through for testing.
Yeah.
There are thousands, millions of kids throughout the world that go through the standard immunization schedule, and they're receiving their benefits immediately. By delaying it, you're still posing a risk for your kid or your child to not be fully immunized against any type of disease.
Yeah, exactly. And there are some doctors and some people that will let you, they object to having so many vaccines at once. Some people think that's the problem. But there are some well-known doctors like Dr. Sears that has a slightly different schedule that doesn't really delay it, but it means you're going to the doctor more because you're going to get this vaccination this day, and then a week or two later you're going to get this one rather than having them all on the same day. But that's a parent's choice too, and something they can research. But it still gives you the protection. So you're right. The research and the proof shows. And as a mother, there was vaccines for most of these things except chickenpox. At the tail end of the kids that got chickenpox, and horrible thing to live through. And I would much rather have my child cry for 2 seconds after a shot than go through what I went through with 3 kids with chickenpox.
Exactly.
And the scars, my kids all have chickenpox scars still. You just don't want that.
And with chickenpox or varicella, in the state of Illinois, for public schooling, and I think also other schooling, by 2019, really to qualify for part of the back-to-school immunizations, you're going to have 2 doses of chickenpox vaccine. And most students will have that as part of being able to enter into school. So right now they've already started the
phasing that in.
Having the not update but the booster shot of varicella. And so by 2019, as long as you maintain again that vaccine schedule, by the time your kids start school, they'll be fully immunized for that and be ready for it.
Great. Well, and some of the other things that have been in the news have been pertussis, whooping cough.
Yes.
What about these vaccines? Why has that one gone out of favor?
Again, it's one of those ones where we don't see it, we don't necessarily understand it. But whooping cough is one that is very sadly, really, when you see it in infants, is something that is just heartbreaking. And the best way to do that is if you're pregnant, I mean, such as myself, and now the new guidelines is that pregnant mothers, even if you've already had the vaccine, for every pregnancy, you should get a booster of it. As well as individuals that, are near your child. So your spouse, your partner, grandparents, asking them to really work together to really protect something that doesn't have the ability to get vaccinated yet.
Yeah, that's interesting. That's a new recommendation I didn't know about. And then flu shots.
Yes.
Flu shots. We've talked about flu some, but I'm interested in that 6 feet. You can be 6 feet from somebody who doesn't even know probably that they actually had the flu yet.
Exactly.
And get it.
Yes, and you'll notice that we're really lucky in Peoria County. We have a really strong healthcare community that works in collaboration with the health department. That when it's time for that flu season, we not only talk about getting a large vaccine campaign out there, but also when you're coming to the hospital or areas, to really use what we call non-pharmaceutical interventions, such as face masks. Make sure if you feel like you're sick, don't visit the hospital to see a loved one. Stay home from work as well. You don't want all of your coworkers to also come down with the same thing. So
I think we have a lot of trouble in this country doing that, either because we don't have sick time or because we're so worried, about hanging on to our jobs and not losing traction, having somebody, overtake whatever it is we're doing. And it's sad that it has to be like that, but I think people need to talk to their supervisors and realize that, they'd rather you stayed home.
And really, the best way defense against that too is getting a vaccine.
Yeah, get a vaccine and you won't have to worry about it.
Yeah.
Exactly. Well, okay, this is only like, early June, but we've got a back to school to-do
Definitely.
here. So what do we need to do right now? What do parents need to do right this minute?
Schedule your vaccines and please go in. Lots of schools have criteria where after school starts, if your student is not fully immunized, that they will ask you to, stay home. And as a lot of working parents know, that's not as easy as just, they're going to stay home for a while.
Yeah.
So as soon as school's over, start contacting your family care doctor, the health department, wherever you need to, and really look at getting your schedule for your immunizations.
Okay. This is a picture of an immunization clinic. And so does the county health department offer immunization clinics?
We do. We do have, we offer all the vaccines that you need to start school and be ready for school. We also have foreign travel. So if you are traveling to a different country where disease there is much more prevalent than here, there's always that recommendation that you should get vaccinated against what you might come into contact as well. So there is a foreign travel clinic as well.
Oh, okay. And how does one find out about those?
So the best resource, the two best resources that I know of is, of course, you can call the health department. And they're more than willing to help you. And also, when you can go to the CDC or the Centers for Disease Control and Prevention website, cdc.gov, and they actually have a travel section where you can click on the country that you're visiting, and it will link you to what immunizations you need, and as well as possibly what other additional ones you would want to have as well.
Okay. So when the City-County Health Department does immunizations, is there a reduced cost for those, or?
So we do have what's known as the Vaccine for Children's Program, or VFC. This is a federal government program in which vaccine is made available for free. The vaccine itself is free to the government employees or government in general, and we're able to administer it at a lower cost. But now with also the Affordable Care Act, immunizations are also covered. So the best thing you can do is first check with your primary care provider or your medical home, so to speak, to see what vaccines they have available. And if you qualify for VFC, some of our healthcare providers also have that available. And if they don't, you can always come to the health department.
Okay, great. And this is a great cartoon, which just reminds me of how important it is for adults to set a good example for their children.
Definitely.
Yeah, anybody who's dragged a screaming child who remembers what a vaccination feels like, just a little pinch, not anything that big a deal, but just the thought of it can send people through the ceiling. So adults setting a good example, I think, is important.
Yeah, and the big ones that adults can get is, again, the influenza vaccine in the fall time, around September, October. Add that to your to-do list, so to speak. Depending on your age, the pneumonia as well.
I've had that one.
Yeah. Shingles as well is another option.
Yes.
And then make sure you get your tetanus booster as well. And if you haven't already, make sure you get your pertussis that goes along with that, or Tdap as it's known. So you want to make sure you get that as well, at least once.
Okay.
And then for pregnant women, again, also you want to get that booster at each pregnancy.
Okay.
And there's lots of also interesting things about vaccines that parents should also know is that really there's especially with adolescents, we know we go to the doctor all the time between birth to 4 years old with vaccines. But even after, we want to make sure we stay in touch with our pediatricians as well as monitor, because there's a lot of great vaccines out there, such as the HPV vaccine.
Right.
Which
another controversial one.
It's another controversial one, because I think it's a lot of times has to do with understanding what it is. So the HPV vaccine is good for both boys and girls. Usually we like to get it done when they're around 11 or 12. And what it really does is it vaccinates against the herpes virus, which is where the controversy comes in.
Yes.
Exactly. But the people don't realize is that the herpes virus can depending on how many times you get infected, as well as the level of infection, can develop into cancer. So really, the HPV vaccine is really a cancer prevention tool.
Yeah.
Much like you don't want your kids smoking,
Yeah.
you don't want your kids smoking, think of it the same way. Get the vaccine, it really does help as well. And that's why we target it at that age group as well. Because at that age group, we know, most parents know they're not sexually active, and so at that point in time, you want to get it then and there.
Yeah.
And even if you have to delay it or you're still uncertain, it's really good to go ahead and get those 3, again, the full schedule is 3 shots, 3 vaccines, and boys and girls can get it starting at age 11.
Okay.
Yeah.
Well, and sometimes you have to just set controversy aside. And the other thing I think that's important to know is you do not have to discuss your health care decisions with everyone you run across. In other words, if you think, Grandma and Grandpa are going to object, don't tell them. They don't need to know what goes on in the doctor's office. That's something I think that's good advice for a lot of people. But if this vaccine, just do it.
Yeah.
Stop worrying about it and don't tell people if you don't want to get into a big discussion. And here's all the things that the health department can do for the whole family. You've got all sorts of things on there that can go on. So I'd encourage everybody to give you a call or look at your website. But Monica, thank you so much for joining me today.
Thank
It's
you.
been very informative. If you need information about vaccinations or immunizations or all these other topics, you can check at the health department website. If you can't find it, be sure and ask your librarian. And you can find our database if you're deciding what to do about something at peoriapubliclibrary.org. You'll also find our calendar of events there. It's summer reading time. Make sure you sign up and make sure you check in weekly for a chance to win some really great prizes and keep those kids busy and yourself all summer long. We'll see you next week on Information Please.